Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Hello. Good morning, everyone, and thank you for joining us today, and welcome to another episode of A Snowball's Chance in Healthcare. I am Josh Butler, president of Butler Benefits and Consulting in Amarillo, Texas. I am a healthcare consultant to employers and their employers all across the country. We're helping employers discover innovative healthcare solutions that address things like cost and quality in healthcare. And today we've got another really hot topic, ladies and gentlemen. It's something I'm extremely passionate about in my business, and a lot of people have coined this issue. It's a major issue as America's other drug problem. Okay, it's just a major issue in this country. It's such a major issue that it's causing a huge amount of unnecessary physical and emotional suffering, financial loss, even premature death. This issue is also described as a silent killer because of the sheer number of people that it impacts with almost zero social awareness. This healthcare issue leads to approximately 125,000 preventable deaths and about $300 billion in avoidable healthcare costs year over year. Now, in the wake of all these mass shootings that have been going on and taking place in this country here recently, society is having a very vigorous debate over gun control, and not to detract from that issue whatsoever, because it's a critically important topic that deserves a whole lot of serious conversation, and it's extremely important. But just to kind of give you a little bit of context of what we're going to discuss today, a person is 10 times more likely to die from this issue that we're going to discuss today than they are from a homicide. 10 times more likely, ladies and gentlemen. The issue that we're going to discuss today and that we're going to share solutions for today is medication non-adherence or medication adherence. Medication adherence is defined as taking 80% or more of the prescribed medication doses that the doctor prescribes. So if you're on a monthly prescription, that medication adherence is defined as taking that medication for 80% of the month or more. Okay, anything under 80% is deemed non-adherence. Okay, and so that's what we're going to talk about today, and the impact that medical and prescription drug non-adherence has on people's lives and on self-funded employers and on our economics. And we're going to start with this. Almost 70% of all Americans, okay, have a prescription medication. That's 7 out of 10, ladies and gentlemen. We all take prescription medications, but half of those people do not take their medications as prescribed. And that alone is almost unbelievable to me, right, when you think about that. And so this issue, like I mentioned, is wreaking havoc on people's lives, their finances, and it's forcing employers to act and to do something within their health plans about that. And I know that you may be thinking right now, big deal. Is this really a big problem? Well, I'll let you decide after I share a few statistics with you. Here's the first one. 20% of all Medicare patients, that's folks that are over 65 years old. So 20%, 1 out of 5 Medicare patients who've been hospitalized for a sickness are readmitted to the hospital within 30 days because of a prescription non-adherence, because they didn't take a prescription drug correctly. That's 1 in 5. Here's another one, and this one really disturbed me when I came across this the statistic here. Between 41 and 59% of mentally ill patients take their medications, quote unquote, infrequently, or not at all. Now, I want everybody to stop and pause, and I want you to think about this for a second. Think about how this single statistic right here, think about this one issue right here, contributes to other major societal issues that we're seeing out there today. Things like unemployment, homelessness, suicide rates, even violence. Yet, among this raging gun control debate, you don't ever hear people talking about this statistic right here. You don't hear people talking about this issue right here. Half of mentally ill people in this country are off their meds, are not taking them correctly. And this one really hurt me. It just kind of shook me a little bit, to hear things like this. Here's another one. 49% of people with a prescription for a chronic condition, that's things like cardiovascular disease, they stop taking that prescription within the first year. Now, cardiovascular disease is still the leading cause of death in this country, and it has been for many years. And much of this issue with cardiovascular statistics has so much to do with prescription non-adherence. In fact, here's some further statistics to illustrate and emphasize this point. Among patients with high blood pressure, 89,000 premature deaths could be avoided each and every year with simple, appropriate medication treatment. Think about that. 89,000 people a year die, and it's attributed simply because of prescription non-adherence, directly for prescription non-adherence. And here's the last one. A whopping 31% of all new prescriptions that are written for diabetes, high blood pressure, and high cholesterol, they never get filled even one time, ladies and gentlemen. Not one time. Almost a full third of prescriptions for those chronic diseases. Now, I could go on and on and on for hours with all kinds of statistics that would shock you and surprise you, because I know that when I was doing research and when I've done research in the past, I come across these things and I'm always blown away. And beyond the cost to human life, which is what we've been talking about, the actual financial impact is equally staggering, folks, okay? As I mentioned a little bit earlier, prescription non-adherence alone results in about $300 billion per year in avoidable healthcare costs. That's a lot of money. And the National Library of Medicine, they estimate the annualized cost to be as high as $500 billion, not even $300 million. And to me, this is just unfathomable. And folks, this is barely even on anyone's radar, okay? CVS Caremark research indicates that only 68% of doctors said that they were interested in receiving notices if and when their patients became non-adherent on a prescription they wrote. Only 68% of doctors said they wanted to be notified if their patient didn't take their meds the way they were supposed to take them. And that's also kind of disturbing when you think about that. Now, to my knowledge, no major organization or entity out there's not one, no major group has really taken prescription drug adherence on as a priority. And that also includes health insurance companies and health plans. They don't care. They have other priorities. And very few have addressed this issue in any meaningful way, right? So why don't people take their prescription drugs the way they're supposed to? Well, there's not a single reason why any person doesn't take their meds the way they're supposed to take their meds. But a few of the major reasons, here's a few major reasons. Lack of motivation, depression, denial, cognitive impairment, drug or alcohol abuse, low education levels, side effects caused by taking the medication in the first place, inconvenience, and of course, ladies and gentlemen, there's cost, right? And because of these factors and several other factors as well, many doctors and organizations see this solely as a problem that's the patient's responsibility to fix. Very few people deem this to be a systemic problem in healthcare. But I do. I think that this is a systemic problem in our healthcare system. And if you hear me, on this program, I frequently talk about fee-for-service healthcare. Fee-for-service healthcare provides little to no incentive for physicians to address prescription non-adherence. Our current healthcare system, which is the fee-for-service system, fee-for-service model, doesn't financially reward doctors for quality or improved patient outcomes. But what our system does reward is more quantity and volume of services provided to the patient. Now, that's a systemic problem, ladies and gentlemen. That's not a patient problem, and it's not a doctor problem. It's a systemic problem, right? So the question is, can it be fixed? Can it be addressed? Can it be improved? And this is where I'd like to pivot, and because we know that this situation can be improved upon. And so we're going to pivot here, and we're going to talk a little bit about health plans that can and do address the issue of non-adherence and health plans that provide solutions. So I just mentioned that cost is one of the leading causes of prescription drug non-adherence. So obviously, if you address the cost of prescription drugs within a health plan, well, obviously, there should be some type of, yield, some kind of return, some type of result, right? Here's what we do know. Medication adherence saves money, folks. Now, if you're a self-funded employer, you self-insured employers that listen to this program or you watch the podcast, I want you to listen up because you need to hear this. For every 10% improvement in medication adherence, there's up to a 29% reduction in healthcare costs overall. Walgreens conducted their own research and they found similar results. They found that for every 1%, just 1% improvement in prescription adherence saves about $50 in overall healthcare spending. Now, guys, this is big. This is enormous. It's an enormous opportunity for employers to do something about this issue, to help their employees in a way they've never been able to help them before. I'm going to continue. Diabetics who take their medications as prescribed save on average of $6,000 per year versus a diabetic who's non-adherent with their prescription medications. So, you self-funded employers, I got a question. What are you doing today to make high-cost prescriptions more accessible and more affordable for your employees? What are you doing? Are you doing anything? Well, I can tell you what some employers are doing, okay? I'm going to tell you what some of the savvier employers are doing. What they're beginning to do is they're beginning to customize their self-funded health plans in a way that allows them and enables them and empowers them to address this very issue. One way is by eliminating or drastically lowering prescription drug copays and patient out-of-pocket costs for things like generic maintenance drugs, drugs that treat high cholesterol, drugs that treat high blood pressure and high blood sugar. They're not, that expensive of drugs. And that's something that we do inside High Plains Health Plan that you've heard us talk about. Our prescriptions carry a $0 copay for all generic medication. $0, okay? And here's why. According to the Institute for Human Data Science, in their 2020 report, they found this. Prescription drug abandonment, that's people who give up taking their prescriptions. Prescription drug abandonment rates are less than 5% when the prescription carries no out-of-pocket costs for the patient. The abandonment rate rises to 45% when the out-of-pocket cost for the patient reaches $125. So right there, folks, when the cost just goes to $125, you lose almost half the people that are prescribed their medications. And the abandonment rate balloons to 60% when the out-of-pocket costs reach $500 or more for a patient. So we see this, okay, that the more we cost shift through copays and deductibles and out-of-pocket amounts to the patient, the worse adherence figures get. That's why our high-performing health plans are also including nurse concierge services or nurse navigation services, which are services that are intended to proactively check in with employees and family members on a consistent basis to further improve prescription drug adherence. Our high-performing health plans are integrated with state-of-the-art pharmacy benefit managers, what are known as PBMs, who are not financially motivated, by the way, to sell your company the most expensive drugs or the ones that maximize their rebates or their spread dollars, okay? Our high-performance plans incorporate patient assistance and manufacturer's assistance support to help people learn about getting these needed medications for free, okay? Now, if you tuned in last week, you'll remember I told a story about how I recently helped a woman get an $84,000 medication for free. And that saved her employer about $81,000 that year, or for the year, and it saved her directly $3,000 a year in copays. And guys, these aren't one-off scenarios, okay? These aren't random examples and one-off examples. The health plans that we construct and we build for self-funded employers, we do this embedded and ingrained within the plan design. It's administered within the plans that we construct. And so this is how we're helping hundreds and hundreds of people afford their necessary medications by removing these financial barriers. Our high-performing plans also utilize things like international sourcing strategies for many different prescription drugs. I mean, you guys know about this, right? Y'all have heard about this all over the television, and you know how much cheaper prescription drugs are in other countries compared to here in the U.S. Now, I know you've heard about it, but I'm going to give you some specific examples, okay? Humira, okay, is the top-selling drug in America and has been for a long time. It sells in the U.S. for approximately $6,500 per month. Sold in Canada, same drug, same manufacturer, which is AbbVie, for $2,200 a month, okay? Skyrizi, which is a psoriasis medication, $18,000 a month, folks, for that medication here in the U.S. Same drug, $6,500. Trulicity is another one, a popular biologic drug that treats type 2 diabetes. It's $800 a month in the U.S., and it's only $340 from Canada, right? Massive price variance, massive differences, right? Hello, employers, self-funded employers, are you hearing me? Are you hearing this? Now get this. You just heard how much cheaper these meds are internationally, but allow me to really blow your mind real quick. The manufacturers who make all three of these drugs actually give these medications away to patients for free as long as they meet a few criteria. Now, I'm going to tell you three of them real quick, the three main. Criteria number one, they must obviously have a valid prescription for the diseases that these drugs treat. There's no off-label usage that qualifies a person for patient assistance. Got to be used for the correct diseases. Criteria number two, they must financially qualify for assistance. Okay, we're going to come back to that one. And number three, they must be, quote unquote, uninsured for the medication. Okay, now we're going to cover these criteria 2 and 3. We're going to assume the first criteria, that it's a valid prescription. Okay, so let's focus on 2 and 3. For each of these medications that I just named, a person and or their household can earn on, like, for instance, for Humira, a person or a household can earn up to 600% of the federal poverty level and still qualify to receive Humira for free. Now, ladies and gentlemen, 600% of the federal poverty level for an individual is $82,000 per year. You make $82,000 a year and you're a single-member household, then you financially qualify to receive Humira for free. And that's a very expensive medication. A household of 4 who earns 600% of Medicare, guys, that's $166,000 per year that household can earn, and the person can still qualify to get Humira for free. Now, this right here brings up a slew of questions that self-funded employers need to be asking themselves. Number one, how many people in your organization are currently taking high-cost drugs like Humira? How many? Do you even know? Do you have the information on it? Here's the follow-up question. How many of those people qualify financially to get these drugs for free directly from the manufacturer? Okay? I just have to scratch my head and wonder how many employers are out there paying $80,000 a year for Humira when their employees financially qualify to receive it for free. It is a huge question. And my last question is this: who's doing this analysis for your organization? Anybody? What does your broker do for you? If your broker doesn't do this type of analysis for you, call us. We'll do it for you. We will show you where your dollars are being spent. Okay? Now let's talk about the second criteria, because this one's a little bit more complicated. In order for the employee to receive Humira for free, they must also be uninsured, right? But you may say, well, hang on a second, the employee's on our health insurance plan, so they're not uninsured, so they're not qualified. Right. But what the manufacturer really means here is that they must be uninsured for that drug, for that medication, not completely uninsured. Okay? But then you may reply back, but our health plan covers Humira. It's on our formulary. It's on our formulary. It's a covered medication. Yes, it is. And I'm going to tell you something. If you call up your insurance company, you call up Blue Cross Blue Shield or Cigna or Aetna or Humana, and you ask them to simply do what's called a carve-out and to remove Humira from the formulary, to exclude it from coverage. Now, I want to prepare you, okay? Don't say I didn't warn you, but be prepared to be laughed off the telephone when you ask the big insurance companies to do this type of thing for you. They won't do it. And the reasons that they won't do it are for another day, okay? Now, our high-performing health plans, however, they have the ability to remove these barriers. Plans like what we've created in High Plains Health Plan. So we execute a number of strategies for self-funded employers that dramatically impact the cost of care and the cost of prescription drugs. When cost is a leading cause of prescription non-adherence, we execute solutions that solve the cost issue. This is a key way, ladies and gentlemen, that we are saving self-funded employers money while improving the quality of life for their valued employees and their family members. Improved adherence drives down medical costs. Improved adherence reduces hospital stays and ER visits. Improved adherence saves people's lives. So it's just a big deal. And there's another path. There's another path. And this show is all about shining a light down that path, a path towards better care, better access, and yes, lower costs. Now, right now, we're in a period of very high inflation. Items like food and gas and clothing have really gone up in price, and everybody's talking about it. But few realize that healthcare costs have been outpacing inflation for years and years and years. Millions of consumers right now are being forced to decide between purchasing their prescriptions and other healthcare services and other basic living needs. This is the Maslow hierarchy of needs applied to healthcare, folks. When people face the no-win choice between buying food and or paying for their prescriptions medication, they will undoubtedly cover their most basic needs in life, like food and water and shelter, far before that they're going to fill their insulin or their blood pressure medicine. So, what is your health plan doing to reduce and or eliminate the cost of prescription drugs? Are you starting to put these topics together yet? If you listen to more than one episode of A Snowball's Chance in Healthcare, are you starting to see the solutions more clearly? Self-funding is a vehicle to deploy these strategies that we discussed every week, like direct primary care, transparent TPAs, and then patient assistance programs for prescription drugs, things that we're discussing today. The path to lower healthcare costs is not higher deductibles and higher copays. The more we do that, the less adherent people become because now it costs more to remain adherent. It's a vicious cycle, and the proof of that is in the data. When you increase deductibles and copays, people don't become better shoppers of healthcare. They simply delay and forego healthcare, which leads to larger, more costly claims down the road. But I'll tell you, there's hope. And more employers are beginning to discover that there are different ways to deliver high-quality healthcare to employees at a fraction of the cost. This is one way that we do it within very high-performing health plans, like high-performing health plans. It starts with getting the data and getting the information that you need. Like I said, if you don't know how to get that data, if you don't know how to start that conversation, reach out to me. This is the work we do. This is what I'm passionate about. This is what we are recognized for at Butler Benefits, this work. And so you can tell that I'm pretty passionate. Well, that's going to do it for this week, folks. I love this topic. I'm passionate. Join me next week, same time, same place. I'm going to be discussing yet another hot topic in healthcare. And as always, I'm going to be arming you with solutions that you need to have a snowball's chance in healthcare.